Susie Williams. Susie Williams is a mother. I have 2 children, a son who's 23 and a daughter who's almost 21. I probably recognize it quicker in my children when they had problems with it.
My name is Lisa Thurston. I'm a 33-year-old mother of 2 from Sewell, New Jersey, and 2 of my children have asthma. My daughter Ashley is 9 and my son Brandon is 5. I don't think anything is as frightening as when you see your child laying there helpless. And even if you had family members that had asthma and you've been experienced or exposed to asthma, it's still nothing as real and as frightening as seeing it be your child laying there, or any child laying there helpless and unable to do anything. So I think nothing really ever prepares you for that.
My son John, pretty much from the time he was just a few months old, but even by the time he was a year and a half, 2, he still would get a cough or get very wheezy when he would be running around playing. Never stopped him from doing what he was doing. Probably by the time he was 4 or 5 years old was the first time that his doctor introduced the inhaler that ultimately I had to use with him. And his doctor ultimately felt that if using a humidifier in his room when he was sleeping at night, elevating him on a pillow when he's sleeping helped, that was better than using something like a nebulizer, because those treatments, you really have to stay with that kind of treatment. And it didn't seem like it was doing anything for him. His seems to be more related to when he gets sick with a cold. That's when his asthma problems show up. Certain times of the year, mold, that seems to be the thing that triggers it for him. So his is more of an allergy-related asthma problem.
Brandon is a 5-year-old, very active little boy. Very happy. He's gotten started in sports as well. He actually developed asthma when he was 4 weeks old. He got it he had a routine cold, which normally is a routine cold. It's called RSV, but in infants it can be fatal. And he went to the hospital. He almost died. He stopped breathing from it.
Yeah, what happened, baby? What happened, baby? I stopped breathing.
He stopped breathing, and we took him to the hospital. And luckily, he went through a lot. He was in there for 10 days. He developed pneumonia from it, and they said he would most likely develop asthma from it. And he did. And he was on an apnea monitor for 5 months after he was released from the hospital. And he's had his nebulizer ever since they released him from the hospital, which he uses albuterol medication for whenever his asthma is bothering him. Since his maturing, into a young child, he still occasionally gets flare-ups from the asthma. Mostly it's with allergies or with colds, or especially in the wintertime, he gets his asthma really bad. It also causes, he's had whooping cough several times from it, and he's very susceptible to a lot of respiratory problems. Luckily, we haven't had any more serious scares. He's gone to the hospital a couple of times when his asthma has gotten bad beyond what we can control with his nebulizer. But we haven't had any more serious, deathly experiences with him. So, actually now given him an inhaler as well, because we're not always at home. He's an active little boy. He's out all the time. So they've now given him an inhaler, but he has to use the spacer with it. So it's still something that we have to aid him with. He can't do it on his own. But they did for a little while there put him on Pulmicort when it was bothering him more often. But since then, he hasn't had to use that as a daily treatment. The albuterol is really what he uses because, like I said, he doesn't need it on a daily basis anymore. He only used the Pulmicort for maybe 5 or 6 months, and that was when he, I think, was 3 years old.
My daughter Arielle seems to have more problems year-round, more of a constant problem. Arielle's wasn't recognized until I guess probably maybe 9, 10, somewhere around that time when she got into gymnastics more, really complained of it, was always a very active child. So ultimately she was diagnosed with what they refer to as exercise-induced asthma, whereas activity is what triggered her problem with it. Hers being more severe in the breathing end of it, really struggling to breathe, and responded well to the inhaler. Didn't have to use a nebulizer, but did have to make sure that she had the inhaler. And I guess she was probably maybe 11 or 12 when they tried the liquid, I can't remember what it's called, the medication that's used supposed to break down the mucus, but it didn't do anything for her, so ultimately we stayed with the inhaler.
It's very difficult. It really is, because you constantly find yourself checking on the kids to see if they're okay. You have to remember to always bring an inhaler with you wherever you go, because you never know when something's going to trigger it. Especially with them being very active with sports, you always get worried you're watching them constantly on the field, not to watch how they're playing, but to watch how they're breathing. Because sometimes you want to just enjoy what they're doing, and instead you're worried about what they're doing.